It is way too early this Monday morning, and welcome to the Religious Studies Project.
His name's Tommy Coleman.
Yes, I forgot that.
His name's Christopher Cotter.
And your name's David Robertson.
And welcome back. As always, this week we've got an interview by Dr. Christopher Cotter with our good friend Wendy Dossett on the subject of religion, spirituality and addiction recovery. So I'll just pass right over to Chris and Wendy.
When we think about religion, spirituality and addiction, a number of things might come to mind. Alcoholics Anonymous, 12-step programs, working with prisoners and so on, that kind of thing. But what are we even meaning by addiction? Why are we considering addiction in the framework of religion, spirituality, or here on the Religious Studies Project? Joining us to discuss these issues and many more is Dr. Wendy Dossett, Senior Lecturer in Religious Studies in the Department of Theology and Religious Studies at the University of Chester. There, she's also Principal Investigator of the Higher Power Project, a qualitative study of the language used by people in 12-step recovery, and Director of Research of the Chester Studies of Addiction, Recovery and Spirituality Group. Among her particularly relevant publications to this interview, she's co-editor of a special issue of the journal Religions on religion and addiction, which we'll make sure to link to from this podcast page, and also the Bloomsbury book Alternative Salvations, Engaging the Sacred and the Secular, which also features some of her work in this area. And Wendy's also appeared on the RSP before in a special roundtable discussion recorded at Chester on narrative and reflexivity in the study of religion, released back in November 2014. First of all, Wendy, welcome back to the Religious Studies Project.
Thank you for having me.
Technological issues aside, it's a pleasure to have you. The listener will be completely oblivious to that, except for the fact that I've just mentioned it. There we go. So we kicked off there by mentioning what even is addiction. Before we can have this whole conversation, we need to set the ground rules and that.
Okay, so addiction, there's always a risk of unnecessarily pathologizing human behavior. But the clinical literature describes addiction as a disorder, substance use disorder, alcohol use disorder, and various process addiction disorders. So they might be particular behaviours like gambling in particular, sex addiction, internet addiction, and so on. And basically they're behaviours that have a negative effect on the person who's experiencing them and on their families, on their communities. So there's an element of social harm there of some sort. They're behaviours that are engaged in a compulsive way. And what people who suffer with these disorders report is sometimes they report a desire not to engage in these behaviours, and yet they do. They want to stop, but they find they can't. Sometimes a phenomenon called denial is a feature of addictive behaviours, where people will say, well, it's not that bad. I'm not doing anybody any harm with this, and they're able to tell themselves that that's the case. But people observing them might describe that as denial.
So there's an element in there of there's sort of a clinical side to it, and there's also I guess a sort of social element. I mean, we don't tend to talk about people being addicted to capitalism and things like that.
I think you possibly could. You possibly could. I mean, actually thinking about capitalism as a frame for addiction, I think is quite productive in some ways. So addiction is often described as a kind of isolating condition, and kind of capitalist neoliberal societies are, kind of produce isolation and imbalances of power and so on. So you tend to find that addiction is more prevalent in communities or parts of communities that are disenfranchised in some way. So colonised communities, for instance, there's very high rates of addiction amongst First Nation communities, Native Americans, Aborigines, and so on, where levels of disenfranchisement, disempowerment is very high. So, there is a political frame to the study of addiction too.
And although we'll not push this, I imagine, I recently interviewed Matt Francis on radicalization. I imagine there might be a way that we could push this to maybe talk about addiction and radicalization, possibly.
Religion as addiction.
Yeah.
There's certainly literature on that. And it would be, kind of explored in terms of the harm that, compulsive commitments to particular views might cause for families and communities.
Yeah. But we're not going to go down that route today. But why are we even discussing religion, spirituality, and addiction? There's maybe, I could think of like sort of colloquial reasons, but you're the researcher, so I mean, why the connection?
So recovery from addiction can happen in many different ways. People sometimes just recover spontaneously. That's a phenomenon that's noticed in the literature. And there are many other recovery modalities and methodologies that don't make any reference to religion or spirituality at all. But my research is focused on Alcoholics Anonymous, Narcotics Anonymous, and the dozens of other 12-step fellowships that exist for different substance use disorders and behavioural addictions. And those organisations, AA was the first of those kind of organisations to come into being in the 1930s in the States. And it understands addiction as a spiritual malady. So the excessive drinking that alcoholics, people are described as alcoholics within this particular view of addiction. What's underlying their behaviour is a spiritual malady that needs to be addressed in order for abstinence to occur. So the 12-step programme, which we hear things about, is a kind of step-by-step programme designed to enable people to address that underlying spiritual malady.
So there's historical reasons for this focus in that those programs exist.
Yeah. And there's historical reasons for why religion is associated with them. In that the founders of Alcoholics Anonymous, Bill Wilson and Dr. Robert Smith, were both influenced in different ways by the Oxford Group, which were a kind of conservative evangelical form of Protestantism around in the States and in Europe, in fact, in the 1920s and 30s.
Right.
And the Oxford Group was trying to explicitly recreate their vision of the early church. So they had recommended practices of arising in the morning and having quiet time to pray and meditate and to discern the will of God for the day. And they had this practice of kind of rehearsing what they considered to be their shortcomings or wrongdoings publicly in a group. So from there we get this idea of that AA has of people sharing in a group, which is kind of the distinctive practice of AA. So its origins were rooted very strongly in religion, but almost immediately that AA began, there was debate about whether higher power, which is a kind of key thing in this discussion, needed to be the god of religion, or whether it could be something else. So higher power in the 12-step way of thinking about addiction is necessary because personal willpower is unable to make any purchase on the problem. So, people want to stop drinking, they want to stop using drugs, they exert their willpower and their willpower fails. So willpower is not the mechanism by which people in AA and NA say that they are sober or abstinent. They say a higher power is required. But that higher power can be anything, so long as there's a recognition that it isn't willpower. So my research in the Higher Power Project is really exploring contemporary members of these 12-step fellowships, taking into account that kind of strongly religious history, but asking people who describe themselves as being in recovery by this method, what is your higher power, and how does it work, and how did you arrive at your concept of higher power? What's influenced it? Has it? Did you have a prior religious belief before you came into recovery or not? Do you describe yourself as religious now? Has your concept of higher power changed over the course of time that you've been in recovery? So trying to get a kind of a contemporary snapshot to set against that historical stuff.
Yes, and there's going to be a lot of assumptions that come along with the way that people will bracket off AA and other 12-step programs as religious or things like that, and which I know that your research challenges. But you've mentioned the Higher Power Project there, giving us a bit of an insight into sort of guiding questions. But I always like to ask in these interviews, how might one go about researching in this area? And I can imagine, particularly working with people in recovery, that there could be various ethical issues and methodological issues. So maybe if you just tell us a bit about that before we get into the nitty-gritty of your findings.
Well, I've got some background in working with people. I worked in a treatment centre for a year, so I've got a bit of professional background and training in that area. Obviously, it's researching a potentially vulnerable group. And that has ethical implications, which can be mitigated. So ways in which we've attempted to mitigate those is we don't interview anyone who's less than 6 months away from their last drink or drug or whatever their particular issue was. So they have been in sustained recovery for a significant period of time before we interview them. And we also make sure that they've got in place various supports, so they know right up front what we're going to be asking them about. And we ask them to make sure that if they're working with a key worker or a sponsor, that person knows that they're participating in our research, and that they're aware that they'll be potentially talking about things that are quite troubling. So those ethical issues certainly needed to be taken into account.
So we might as well just dive right into your research then. So I know that spirituality is a word that comes up throughout your writing and throughout this material a lot. And maybe that's a word that we haven't yet introduced into the interviews. So perhaps let's take us through spirituality and maybe 12-step spirituality.
So AA and NA explicitly claim that they are spiritual but not religious. And Robert Fuller, who wrote that 2001 volume, Understanding Unchurched America, the spiritual but not religious, Understanding Unchurched America, he actually credits AA with bringing that term into the fore. The reason that these groups claim to be spiritual but not religious, they are fiercely independent. So they're not aligned. They explicitly say they're not aligned with any sect or denomination. There are no requirements of belief to be a member. The only requirement is a desire to stop drinking or using drugs, and that's just a desire. It's not even a requirement to have stopped. So they are not, they argue, religious organisations, but they do argue that underlying problematic substance use is a spiritual malady, they call it, which is based on things like self-centered fear, anger, resentments, and so on. In order for recovery to set in long term, these need to be addressed, and the 12 steps provide a framework in which people progressively, if they choose to, there's no compulsion, but if they choose to, they look. So in steps 1 to 3 are about acknowledging personal powerlessness over the substance and acknowledging the need for a higher power, whatever that might be. Steps 4 to 9 are about looking at the past and identifying behaviour that might have been damaging to the self or other people that occurred during active addiction. And there's a process of kind of looking that in the eye, coming out of denial, my participants would say, about that behaviour, and where possible, without causing any further harm, addressing that in some way. So steps 8 and 9 are called the amends steps, where people try to take responsibility for things that they had done in addiction, and to try to mend relationships where those were damaged. And that's kind of seen as crucial to the recovery process, because people who've experienced addiction are often at odds with the world and with their families and communities, and it's very hard to stay away from substances that give you some relief from those feelings if you haven't addressed them. So then steps 10, 11 and 12 are about prayer and meditation, and developing a more ongoing relationship with a higher power. But in terms of that concept of higher power, lots of our participants make no theological or metaphysical claims about that higher power at all. They'll say that their higher power is the people that they have met in these fellowships, their friends who are walking the same path as them. They might refer to the wider fellowship. So a kind of classic statement is God. They'll say, God for me, G-O-D, group of drunks or group of druggies. So there's a kind of communitarian idea of a higher power. So it's not them as individuals doing it. It's the group together are achieving something that they couldn't do on their own. People talk about the power of nature. Some people use terms, kind of very deist terms, like the spirit of the universe. A common one that people will talk about is the Force in Star Wars. Some people will name individual people as their higher power. That's quite unusual in terms of my research. But and one of our participants named her cat as her higher power initially when she first got sober, because she was looking around for something that offered her unconditional love, and she felt the only thing in her life that did that was her cat. So her cat functioned as a higher power for a time in her recovery. So there's a kind of massive scope within 12-step programs for people to develop this concept in whatever way they want to.
And so we as researchers need not approach this, let's say, through the lens of religion or spirituality, because you could psychologize that if you wanted to. But I gather from reading some of your work, the part of your argument would be like to respect the language that's being used.
I think it's allowing your participants to describe things in their own terms. And I think, that's particularly important in this research site, which is often characterized in different ways by outsiders, and the insider voice is actually very rarely heard. there's quite a lot of vested interest from a clinical point of view of saying AA and NA are religious organisations. So, because they're free, they're naturally existing within communities. So, professional treatment services see them potentially as a threat, unfortunately. I mean, it's an absurd kind of situation, but they're often very keen to describe these organisations as religious organisations. And, what I would hope that my research does is for sure acknowledges the religious roots and the strongly religious language in their formal literature, but to use the tools and methods of religious studies to say, well, what is the actual experience of contemporary people who work these programs, and how are they dealing with, the language, the very Christian language of their texts? How are they dealing with the male language of their texts? I mean, the main text of Alcoholics Anonymous, the big book, was written in the 1930s in the States by white Christian men. There was a couple of atheists in there, but that language is kind of its time. So how does a non-white woman in contemporary AA kind of encounter that kind of language? And obviously we've got tools within religious studies to help us kind of notice these things and to not characterize traditions solely in terms of their origins or solely in terms of their texts. And to be interested in how contemporary practitioners kind of negotiate their authoritative statements within their tradition.
Yes, and it's a really excellent sort of one of those boundary cases that you can certainly see the religious roots, you can see the spiritual language, you can see the various splinter groups, that you talk about, sort of atheist groups and agnostic groups and feminist groups and that kind of thing. You can see all that, but rather than needing to pigeonhole it into one box or another, we can analyze those various elements.
We're good at complexifying things, aren't we? But, hopefully complexifying in a way that is helpful for people who want to know more about these organisations.
We're already getting towards time being done, which is fantastic because it's been a nice free-flowing conversation. But so before we get to that point, I always would want to ask, sort of where are things going? Maybe you can reflect specifically on the Higher Power Project, which is it coming to a close now? And then maybe this broader field of research where you would like to see things, where you think things are going.
Well, the data collection for the Higher Power Project is completed. There are some publications already out and some due to come out. The monograph is yet to be written. That's all important. But I think there are lots of areas that need kind of further research. So the whole, the emergence of non-religion as a category of analysis within religious studies, I think is particularly interesting and needs to be used explicitly in analysing these sites. So there are AA and NA groups who explicitly identify as atheist. So these are fascinating kind of sites of potentially spirituality, but even some of these atheists reject the term spirituality.
But it's clearly related because of the very atheist nature of the group. It exists in relation to the field.
Exactly. So that I think that needs to be explored. I'm always kind of disappointed when I see surveys of contemporary spirituality of any, however that's defined, religion, spirituality, non-religion, that don't mention this, because there in the UK there are 45,000 members of AA practicing 12-step spirituality. according to the AA census. And, that's not far off the numbers of people who identify as pagan.
Yeah.
And you would never dream of a survey that didn't talk about, modern paganism in Britain.
Yeah.
But no, people don't tend to mention 12-step spirituality. So seeing that more in the literature would be something that I would want to see. There's also another kind of cultural phenomenon emerging around recovery from addiction, and that's the visible recovery movement. So these groups that I'm talking about are anonymous.
The spiritual
so they're kind of under the
anonymity,
radar. Yeah, spiritual anonymity. They don't announce their membership of these groups. They don't publicly identify as being members. And they see that as a spiritual practice to do with humility, because their recovery is attributable not to them but to a higher power. So they're not going to say, "Hey, look at me, look what I've achieved."
Yeah.
And anonymity is important in terms of newcomers feeling safe to access them.
But then we know that then leads to it maybe being a more underground phenomenon.
Absolutely.
And not being talked about.
Yeah. So there's this other thing that's happening that's not unrelated, but the visible recovery movement, there have been walks. It's very much based on gay pride, people taking to the streets, openly identifying as being people in recovery or supporters, family and friends of people in recovery, and wearing purple as the international colour of recovery.
Yeah.
It's a very big movement in the United States. It's becoming bigger in the UK. So in the last one in September was in Halton in Cheshire, and 6,000 people took to the streets to kind of declare their recovery and to kind of make recovery visible within communities so that people know that it is something that happens and there are ways of finding it.
Yeah. And so that is going to be a very interesting site for how that affects your research area, but also indeed how it affects the whole 12-step phenomenon. So we're out of time, but I'll make sure in the podcast page to list a link that it was completely open access a journal issue that you edited, so that's all available easily, and you've got a piece is it in the Conversation, was that?
No, it was a blog post on the William Temple Foundation.
That's right. Sorry.
Yeah, that's fine.
My fuzzy brain. But we'll link to that. But just thanks so much, Wendy, for being on the RSP.
It's a pleasure.
Thanks very much for that interview, Chris. It's a real pleasure to get Wendy on again. She appeared, was it about 18 months, 2 years ago, in our roundtable on narrative. And we'll probably be hearing from her again later this year when the BASR conference takes place in Chester this September, and Chris and I will both be there, and hopefully this year Tommy will be there as well, and we're intending to record our Christmas special. Yes, we're thinking about that already while we're there. Tommy, tell us what we've got coming up next week.
And next week, there's a podcast on religion, science, and evolutionary theory with Dr. Salman Hamid.
And that's an interview that was recorded for us by Stephen Jones.
So the other thing that we haven't mentioned is that this is actually our 6th year on air. We started in January 2012. It's now January 2017. So that's been 5 years of Religious Studies Project. And sitting around the table with me, David and Tommy, we've been scheming for the next 5 years. The last 5 years is also a wonderful musical by Jason Robert Brown. Maybe we should make our own musical of the last 5 years of the Religious Studies Project.
Yeah, but if you want to help us going forward into the next 5 years, here's what you can do. You can be sure when you are on Amazon.com, .ca, or .co.uk to use our Religious Studies Project link for all your purchases. And also be sure to like us on Facebook, follow us on Twitter, stalk us on Google+, and don't forget to check out our iTunes as well.
And our ever-growing YouTube page. Thanks for that, Tommy. It's been wonderful having you here in Edinburgh. How are you finding it?
I like it very much. Beautiful buildings, scenery, and good beer.
Well, that about sums up my life, really, doesn't it? Come back on Thursday for the response. Don't forget to check out our Ops Digests every Tuesday. But until next week,
Thanks for listening.